I wanted to talk to you today about what it means to be a caregiver and how to sustain yourself if you find yourself in that position, or if you happen to know someone who's a caregiver, how to support that person as they go through the task. Caregiving is one of the most difficult jobs in the world, without a doubt. It is 24 hours a day, 7 days a week, 365 days a year job that is often thankless, very often lonely, misunderstood, and a job for which one has no training and you never signed up for it. And yet there you are taking care of someone that you love and having to do that all day long. Oftentimes, the pushback will come from the person that you're taking care of, the person you're trying to protect. And that person, whether it's a husband, a wife, a parent, a sibling, or even a child, will not like the idea of being told what to do and will reach out and yell at or use as a punching bag the very person who's trying to protect them, in this case, the caregiver. The other big issue with being a caregiver is that you are trying to manage someone else. You're trying to manage their life in addition to managing your own. Most people don't like to have their lives managed. And when you're an older person who has dementia or cognitive impairment and you need some help from another person, it's very hard to have the other person tell you what to do. You're going to get angry, and the anger falls on the caregiver. So the caregiver has to not only contend with the loneliness and the depression that comes with the caregiving, they also have to deal with the anger and the frustration of the person that they're caring for, who often they deeply love. And that person is someone they may have relied upon, someone whose counsel, whose advice, whose support they have relied upon. And suddenly, at a time when they most need it, they find that they don't have that support, or it's less consistent because the person is not as able to provide it for them. So first, acknowledge, if you're a caregiver, that you have a phenomenally difficult job, and it's a job you're not getting paid for, and that you haven't been trained for. So acknowledge that and be really proud of yourself for having committed to this position. Second, remember that you cannot be a good caregiver unless you take care of yourself. And that cannot be overemphasized. A lot of times as a caregiver, we may feel guilty going out for a manicure, going out for a walk without our spouse or the person we're taking care of with us. That person may get very anxious because you're away and you feel very guilty and you want to spend all your time with that person. But as human beings, we also need downtime. We need to be able to take care of ourselves. And when we don't, it manifests in other ways. We may be more likely to snap. We may be more likely to be angry with the person that we're taking care of. So it's very, very, very important. I cannot stress this enough, that as a caregiver, make sure that you take care of yourself. And the number one way to do that is to schedule daily breaks. By that, I mean an hour a day or 5 minutes several times a day when you are just by yourself. If it's for an hour a day, you can make arrangements with a family member who can come and spend time with a caregiver, or pay someone to come in to spend time with the caregiver, with the patient, so that you can then have some free time for yourself. So you want to make sure you do that. Make sure that you have that spare time for yourself. The second important thing that caregivers need to do to make sure that they don't burn out is that they can't perform too many roles. When you're a caregiver of someone you love, you may find that you're not only taking care of their making sure that they're taking their medications, you may also be taking care of the fact that they're sitting too long looking at the television, and you keep telling them, get up, go outside, do some exercise. You may be telling them what kind of exercises to do. You may be telling them when to take their medications. So you become effectively their nurse, their physical therapist, their personal trainer, their manager, and you still have to be their spouse, their husband or their wife. You can see how there's very little room for you to manage that if you're doing too many roles. So I usually say if there's a way that you could get your physician, your loved one's physician, to write scripts for physical therapy, to write scripts for um, someone to come and help with language therapy, then that will give you some space so you don't have to take care of that also. You'll find that you'll have more and more and more and more things put on you, and you don't know how you're managing without breaking. And that brings me to another point that more often than not, caregivers, especially unpaid caregivers, who are often family members, are women. And women tend to bear this burden because we've been given um, over the years this kind of um, role of having to care, and often without complaint. And that's wrong because it is difficult for any human being to sustain it, whether it's a man or a woman, but women tend often to turn it internally and become more and more depressed. So seek help for yourself. Make sure you create breaks for yourself. Understand you can't take on too many roles. The other thing is, don't expect people to understand. That's a very hard thing for us because we're all social animals and we expect to be able to have a network of people who understand what we're going through. And often that may be family members, that may be children of a couple. And they may say, well, dad doesn't seem that bad, mom. I don't know what you're talking about. Or he seems fine. He seemed fine when I spoke to him on the phone. I don't know what you mean when you say he forgets. And then you go crazy trying to explain that no, dad does forget. And you try to justify some of your frustration. It's a hard road and it is a lonely one, but don't be surprised when people are not as supportive as you think they should be because they truly don't understand. Unless you've been a caregiver yourself, unless you know what that feels like, it's very, very hard to truly put yourself in those type of shoes. They're very heavy shoes. And then finally, if you know someone who's a caregiver, here are some things you can do to help. Listen to what they're saying. Be available when they want to call. Offer to help in very simple ways. Say, listen, how about I come over once a week for an hour every Friday and I'm going to take over, I'm just going to stay home and you can go do what you want. Just offer that. But be consistent because consistency is something that a caregiver often does not have in their life. So if you can provide that consistency and that reliability and say you'll be there for an hour a day, once a week, that means a lot for a caregiver because they can look forward to that hour like it's a vacation and you have no idea how wonderful that feeling can be. Now, here I'm talking mostly I've been focusing on caregivers of patients with dementia and Alzheimer's, but this really applies to caregivers of any kind, caregivers of children with chronic illnesses, caregivers of adults who have chronic issues like multiple sclerosis that's progressive, any kind of caregiver, caregivers who are physicians or nurses who have to work in chronic settings, but they get to go home. But even they can experience burnout. I know I myself have in the past, and it's taken me time to learn how important it is to connect with a person, whether it's a patient or a caregiver, in a human way in order to prevent myself from having a burnout. I hope that was helpful to you. Thank you very much.